I'm Jaylee,
And I'm Corey.
and welcome to the conversation.
All right. So today we thought we'd talk a little bit about what's going on with COVID-19. I know we're all kind of feeling a little fatigued with it. Uh, However, it's a reality. It's our reality here in the United States. I think we're now past uh, 270, 280. Do you know how many there are?
200 and something.
You know, we ought to look at the map.
Lost count.
Should we look at the map?
Yeah, we can do that.
Okay. It's very sobering when you look at the numbers. I'm going to go ahead and share my screen. And we'll go here. So globally, we've had over 71 million confirmed cases. Globally, we've had over 1,500,000 deaths. In the US, we have a disproportionate number of confirmed cases. We've got going on 16 million. And this is the number that just pains me. We have just shy of 300,000 deaths. So what does that look like on the map? Cumulative cases. You know who's done really well through this is most of the UK across the world, except for the homeland in Britain. I mean, look at Canada. They're part of the UK, and they are way less than we are. If you look at Australia, New Zealand, Africa's done pretty well. I don't know what their population is over there on that continent. Do you know what the population is of the continent?
I
I don't know. But, you know, Australia has the advantage of the cities being pretty far apart, and there's nothing much out in the middle except for smaller towns. I think right about here is Alice Springs, and it's not very big, and it doesn't look like they've had any red at all. Darwin is very small. They hardly had any of it there. New Guinea looks really good. New Zealand, Tasmania down here, they're part of Australia. They have one little red dot. The United States is solid all the way across until you get like to Colorado. But Texas is solid. It's pretty bad. So what do those numbers mean if we look at a list of American cities? Right now, we're inching up on 300,000. So if we look at, here it is, Greensboro, North Carolina is right about at the same population of the number of people we've lost. And that is a staggering number. If you think about Greensboro, it's just right under Pittsburgh, you know? There's Pittsburgh. Everybody knows Pittsburgh is a big city. It's not a metropolis, but it's a larger city. And St. Louis is right there. Cincinnati, we're inching up on. But if you imagine every person, every man, woman, and child in Greensboro gone, deceased. That's what we've got right now in the United States. So let's go ahead and we'll go to this video we wanted to watch and share with you. It's about patients at the hospitals who have COVID and what happens when they're getting sicker and sicker and it looks like they're going to lose them. So this is a couple of doctors reacting to the way people are dying alone. And this particular fella, I follow him. A friend of mine who's a nurse recommended him. His name is ZdoggMD. So check him out. And let's go.
We're, as doctors, we're so risk averse and afraid that we've let these private equity companies and these people tell us how to practice medicine to make profit. And yeah. I think in COVID, what we're seeing is this is kind of coming to a head in how we're treating our patients at the end of life and saying, oh, you can't have visitors and all this. I mean, what do you think about this?
Yeah, I recently went on a bit of a tirade online about this topic. And, I'll read you what I said.
Yeah.
And then we can go from there.
Oh, my gosh, man.
Yeah, so I saw somebody tweeting some picture of a storeroom full of iPads on like a mobile a rolly cart. And they say, haunting pic.
I saw that. Did you see that picture? I'll see if I can dig it out and include it in our video because it is disturbing. It looks like a room full of, it looks like a music room, you know, when you're in high school or college and they've got a room full of those music stands with chairs, but all that's in this room is iPads on like a stick with wheels. And this room is full of these iPads. It's very sobering.
iPads used by loved ones to say goodbye to COVID-19 patients. And my tweet basically said, hard no. Loved ones should be able to decide if they wish to see loved ones in person before they die with gown and mask and goggles. Inflexible bans are a human rights violation. Loved ones can agree to quarantine after seeing a loved one for 10 days. PPE shortage is not an issue. We can agree to assume the risk with a cloth gown, a drape, cloth mask. That's a loved one's choice. How much they value holding their dying father or mother's hand versus the risk. Risk of transmission can be mitigated by promise to self-quarantine for 10 days. By travel alone to the domicile immediately afterwards, by disposing of the cloth barriers in the room and changing into different barriers on your way out. I see no justification for any policy that does not permit a loved one to hold their loved one's hand as they die. And then I went on basically to say, I don't know why this is acceptable or has ever been acceptable to anybody. And the more I thought about it, how inhumane it is, how awful it would be, how inflexible that ban is, the more I realized that it could not possibly be the brainchild of a doctor taking care of patients. I could never imagine being such an absolute hardliner that I wouldn't find a way for a son to be able to hug his father one last time, even if that's through a tablecloth, that we just pull off the table, but something. And the more I thought about it, I felt a strong anger that it is the product of the administrators and how we as doctors allow other people who aren't doctors to tell us how to be doctors. I think it's absolutely unacceptable and I wouldn't allow it. Period.
There was a picture of a doctor that went viral in the news. Like he's comforting a dying patient. And it's like, doctor comforts dying patient because family can't be there. That doctor is complicit in the policy that allows that patient to die without their loved one next to them. We're all complicit because we're afraid, we're conditioned to listen to authority, and when the authority is behaving like jackasses, you said it's a human rights violation.
Human rights violation.
It's false imprisonment. You're saying, I'm going to take this person and you can't, oh, here's an iPad, right? And put it on a stand and, oh, here, have this conversation. Zoom on the best of days is garbage. At the end of your life, you're going to take that from someone? It's the one thing that they have there?
I mean, I think it's so awful that we have not spoken up and said that this is absolutely unacceptable. There are things worse than death. I think we've forgotten.
Absolutely.
Much worse than death. And loss of who we are as human beings is worse than death. yes, the virus is something to be feared. It is a serious threat. And yes, we ought not to take risk for no reason, but there are things worth taking the risk for. And to hold your mother or your father's hand one last time is clearly in that category.
Yeah.
And I think that any doctor who practices, if you were practicing, 50 years ago and you were in charge of making the policy, you would never make this absolute policy. You would say, look, we're going to find a way to do this. We're going to try our best to mitigate the risk, but this person has got to be able to say goodbye. There are so many people who didn't get the chance to say goodbye to their loved ones. We can't take that away from people. And to do that out of the sense that you're doing that for the good of the public health, that's a tragedy. That's being risk averse to the point you've forgotten what it means to be human.
Absolutely. And the worst part of it is then we get angry with the public for not listening to us, tisking them about staying home and wearing masks and social distancing. We get angry. You're overwhelming our hospitals. You're doing this and that. All that's true. But yet we won't give them the dignity to be with their loved one at the end of life. And that is on us. Like, to absolve us of this would be absolutely incorrect. It's false imprisonment. It's a human rights violation. It's not what we would want. How many of us do you think, if one of our loved one was there, would get them in that hospital?
Of course we would. We'd
1,000%.
break every rule or steal some PPE, and people would do it.
Absolutely.
And you wouldn't even have any. You wouldn't even feel too bad about it.
Not for a second.
Not for a second, because there are things worse than death,
Yes.
and there are things that you go so far, you push people so far, and you take away human things, and you're saving something that's lost its meaning. The human life is meant to have these emotions and to have these reactions. I think it's despicable, and I think the failure is on the medical profession. I mean, we have allowed year after year death by 1,000 cuts,
Erosion.
erosion of the authority in the hospital from us to other people who don't train as we do, don't take oaths as we do, and they tell us what to do. And I don't allow it. I mean, as a doctor, when I really want something to happen, it's going to
I
happen.
think it's crazy that the administration, the hospital administration, allowed patients to die without their loved ones being by their side.
Have you lost anybody? Have you lost?
Have I ever lost anyone?
Yeah, like ever. Like been
Ever?
there.
Yes.
Yeah, you have.
Yeah.
Yeah, I've lost both my parents previously, not during COVID, and I want to share my story a little bit, and maybe you can. You want to? Do you feel like doing it?
Sure.
Okay. So my mom had breast cancer for 15 years, and my dad, near the end, my dad had developed Alzheimer's, and so he wasn't able to be a really good support for my mom. And I lived 1,800 miles away, but I had been in communication with the doctor, and he promised he would let me know when it was time to come and see them. And I got a call, and he said, it's time. So I got on, the earliest plane I could get was the next day, got on the plane, and she passed 10 days later. And I was able to be there with her and talk to her about things. And then in the end, the last 24 hours, she kind of slipped into like a coma state. And she was on, DNR and no medical intervention. They were just giving her meds to make her comfortable. It had moved into her lungs, and she was having trouble breathing. And so that last night, I was there by myself with her. I don't have any siblings. And there were a few people that had come during the evening, but they had all gone home. And I had a bed, a cot in there. And I pushed it over next to her bed and held her hand through the night. And in the morning, the nurse came in and she woke me up, and she said, I think it's really close. And it was the strangest thing, because it was the beginning of October and it had snowed overnight. And it was beautiful outside the window. And I was still holding her hand, and I said, oh, Mom. I talked to her. I didn't know if she could hear me. I said, oh, Mom, you should see. It's so beautiful outside. It snowed. And she just slipped right away. She slipped away just like that. And then my dad, followed her 15 months later, he kept getting pneumonia because he was having trouble swallowing, and he would inhale liquids and then get pneumonia. And so he had been in the hospital like 3 times the year after she died. And then in the end, my husband and I were there with him. And they had come in to bathe him and change his clothes and stuff. And it had stirred up some of the pneumonia, and he got to where he just couldn't get any breath. And I know a lot of times with people who have Alzheimer's, they say that they just kind of forget to breathe at the end. And that's, he didn't think about coughing or anything. He just sort of, and he was, again, like my mom, they were just making him comfortable there at the end. So he had been a singer all his life. Even at the end, he remembered how to sing, just like 3-4 weeks before he passed. There were Christmas carols playing on the radio, and he started singing. They were all surprised at the unit where he was, because he sang the whole song, with the radio, and could still sing quite beautifully. And he was bass and had a wonderful bass voice. But anyway, I had decided that if I could be there with him when he passed, I was going to sing to him. And I did. I sang his favorite hymn to him, and held his hand, and he went. And it's a really profound thing and very personal when you lose somebody that close to you. And I can't imagine. It just chokes me up to think about how it would have been to not be able to be with my parents when I lost them, to have to look on an iPad or a phone, to say I loved them. It's heartbreaking, and it's something you can never get back.
Yeah, so I have experienced death of a family member, my grandmother, great-grandmother, a slew of aunts and uncles. So I have experienced death. Unfortunately, I've never been by their bedside as they passed away. However, the impact of their death was very detrimental to my well-being, especially my grandmother. I remember being in college at Iowa State University for my undergrad, and I was, in school. My mom called me, "Hey, your grandmother just died." Right after she called me, I had to take a test.
Oh.
So I'm trying to remember the answers. My mind was completely blank, even though I had done a presentation like 2-3 days ago, a really good presentation about regarding the contents of the test. So I knew the answers, but my mind was just blank. So I went to my teacher, and I didn't even finish the test. He's like, "Oh, Jaleesa, what's wrong with you? Like, I know you know the answers to these questions." So I told him, "Hey, my grandmother just died, and I just can't remember anything right now." And he's like, "Okay, well, I'm just going to give you some time. You can take the test whenever you feel better." So I ended up retaking the test a week later, and I passed with flying colors, of course. But just hearing that news right before taking the test, my mind was just completely blank. I literally forgot everything.
Wow, that's horrible.
Mm-hmm.
You were lucky, because I don't think all professors are as compassionate as that one was with you.
Right.
Mm-hmm. I know a young woman who was going to college, and her father passed away, and she ended up having to drop out because, she just couldn't continue. And you don't get time off or anything. And yeah, it was a very, very bad situation. I don't think she got to be with him either. But she ended up, years later, she went back to school, and got to fulfill her dream. So it's, you know, life happens even when you're in college, you know, especially when you're in college, actually, I think,
Yes.
you know,
Mhm.
but anyway, it had not occurred to me what they were talking about on this video. It just hadn't occurred to me that they really should be letting people in if they want to go in. I remember near the beginning of the pandemic, there was a doctor, a woman doctor whose daughter was sick and in the hospital. And she wanted to go in and they said no. And she said, I want to go in there. I'm a doctor, you know. And they finally said, okay, well, you can go in, but you can't come out. And so she did go in and she spent the hospitalization in there with her daughter, you know. And but how many people have had to, I mean, admit their parents, admit their children, admit their spouse, you know, to the hospital and weren't able to then have contact with them? So many. I mean, we think about that number again, you know, we're inching right up on 300,000 right now. Number just is staggering. It's
And
heartbreaking.
I do want to mention that regardless if someone is admitted for COVID or not and they're hospitalized, because of the COVID pandemic, you can be in there for having a stroke or having some type of minor surgery, and you're still not allowed
Yeah.
to have visitors. I know if it's a young child under the age of 18, they can have one parent, but not two parents. And definitely, you cannot have your siblings in your hospital room while you're recovering. As I found that out earlier this year with my son who had surgery, only one parent was allowed. And so we both couldn't go. And I couldn't take his siblings with us. And so this is just affecting everyone that has to go to the hospital, regardless if you're being admitted for COVID or not.
Yep. Yeah. So this is the situation in which we find ourselves. So I guess this video really caught my attention because I was thinking, if I had somebody in the hospital right now, would I fight to get in there to see them? And I'm immunocompromised, but I'll tell you, if my son or my husband were in the hospital, I would probably fight to get in there to see them,
Mhm.
especially if I knew they were nearing the end of their life.
Right.
I would fight tigers to get in there. You know, I would.
They should leave it up to it should be the choice of the family, right?
Yes.
To see your loved one or not. And also with COVID, not everyone dies from COVID. Some people are asymptomatic. Some people, the only symptoms that they may have is loss of smell, loss of taste, fatigue, and that's it. So I think it should be up to the family in regards to if they're willing to take that risk or not. I don't think it should be up to hospital administration to make that decision for them.
Yeah, it's not right. I mean, if the hospital wants them to sign some kind of waiver that they're not responsible for infection if it occurs, you know, then do that.
Mhm.
I just think it's wrong for them to withhold those moments from their loved one. You
Because
know.
looking at an iPad or a computer, it's not the same thing.
Oh no.
Being there in person, touching your loved one's hands.
Yeah.
You cannot,
We need human contact.
yeah, technology cannot replace human contact. And this is a little off topic, but it's on topic at the same time, especially with the holidays, Thanksgiving, Christmas.
Yeah.
I know a lot of people, they're still planning on meeting in person for Christmas. They forego Thanksgiving because obviously for many people, Thanksgiving is not such a big deal as Christmas is. And, they're still planning on meeting in person, although in smaller groups. But sometimes, meeting with your family over the holidays in a Zoom call, it's not the same thing.
Mm-mm.
Being in person, eating good food, playing
Right.
games, just having that human contact.
Yeah. And we've gone without it for so long, many of us,
Yeah, it's like for Thanksgiving, I spoke to my parents, my mom, my dad, my sister, my brother, but it wasn't the same. I actually felt a little down on Thanksgiving because I was just at home by myself. You know, that phone call was just
Oh, I thought you went. I thought you went to.
not enough.
Oh, you changed your mind?
I didn't go because my sister was exposed to COVID.
Oh, well, it's probably better that you didn't. It's
Yeah.
hard though. I was thinking about my family's very small. I have one child, a husband, my parents are gone, and my aunts and uncles on one side they're gone, on the other they're quite old. Their kids are my age, but we don't get together for Christmas. When we were growing up, we had these big family gatherings and we would go to them. My mom and dad and I would drive to where they were, and all the cousins and my grandma and everybody was there, and we'd all gather in a big room together and eat and open presents. And it was every year it was the same. We'd always do that. And I was thinking about it. What would my parents have done? And I think we would not have gone, during this time. I don't think we would have gone. I think we probably would have stayed home, talked on the phone, maybe, because there was no internet back then. But
Yeah, just to clarify, I mean, due to the risk of COVID, obviously it's better to do the Zoom call or to do the phone call. It's better. I'm just saying that, the technology still doesn't replace being there in person.
It doesn't replace it, no. Like right now, we're sitting here talking to each other, but I can't give you a hug like I normally do when I see you. I came over to see your babies and I wanted to give you a hug. I didn't do it, but I wanted to, and it that human contact is so important for most people, for almost everyone. There are people who don't like to be touched, but when it comes to their immediate family, that's a little bit different. But yeah, we find ourselves in a really terrible, untenable situation as a nation. And part of the reason we're here is because of the failure of leadership, and people did not protect the people around them. When you wear a mask, you're not really doing a lot to protect yourself unless it's a special kind of mask called an N95 mask. N95 masks have to be fitted, and they're totally not like what we've all been using. What we've been using, the cloth masks, are to protect the people around us from us in case we're infected and don't know it. It protects everyone else. So if everyone wears a mask, you're protecting everyone around you. It should really drop. Our instance of COVID should drop. And so sort of adding to that, social distancing, taking precautions like, don't go to the grocery store if you don't have to. Instead, order your groceries and go pick them up. They'll put them in the car for you. It's not a responsible thing to do right now, to go out in public without wearing a mask. It's just not responsible. And seriously, are we so spoiled that we can't hack this for a little while to save people? Surely we can do this. It's just a mask. And I'll tell you, there are people who've said, oh, it doesn't work, it doesn't help. Well, next time you have surgery, tell the doctor and the nurses and the technicians that they don't have to wear a mask or gloves while they operate on you if you think it doesn't work. So,
Wow.
I mean, yeah,
The
you
thing
know,
is, when I go to Walmart or Hy-Vee, there has been times where I forgot my mask in my car. And just as I'm walking in, all of a sudden I feel naked.
Mm.
Like I don't have clothes on. Like, oh snap, my mask is missing. Let me go back in the car and grab it. It's for me, it's become so normalized. It's become part of my everyday routine that I feel naked without it. It's
Yeah.
like me driving my car without wearing a seatbelt. I instantly notice that something's not right.
I've wondered after this is over if we're going to see people wearing them, like if they have a cold or, because there are in other countries, they do that. They put on a mask if they're not feeling good, if they have the flu or a cold and they have to go out, and it protects the people around them, So I kind of hope that we do, because for people who are vulnerable, a cold can turn into pneumonia, and it's a kinder thing to do, you know. Anyway, do you have any other thoughts about it that you want to share?
Yeah, so before you mentioned the N95 mask,
Mm-hmm.
for myself, I don't really like wearing cloth masks because it also makes me feel very vulnerable. I can feel the air coming in, coming out, and I just don't feel very safe in it.
Mm-hmm.
For me personally, I'll either wear a surgical mask or a K95 or KN95.
Where do you get one?
I bought it online.
Mm-hmm.
You can get one through Amazon. Um, that's where I got mine.
Mm-hmm.
And I like the KN95 mask. There's no air coming out. There's no air coming in. And I do have a couple of cloth masks that I will put over the KN95 mask. So I'm like wearing two masks.
Mm-hmm.
But I just don't wear the cloth mask by itself because for me, it's just not enough protection.
I put a filter in. In the side, you
Mm-hmm.
can slide a filter in. So I got, at the beginning of the pandemic, when there weren't any N95 masks for us, I ordered, actually, this is quite the hack. I ordered a HEPA filter, and it's for a vacuum cleaner, but it's a HEPA filter, so it has the right micron size of filter. And then I took it apart and have it so that we can cut it to the size that will slide right in between the two layers of fabric in our masks that we use. So it's a higher level of, filtration. And I'm glad that I spent so much time looking at videos and trying to figure out what to do to protect us and protect other people, and came across this guy that he went to the hardware store, picked out the filter at the hardware store, and showed how to take it apart and everything. So I was like, okay, that's what I'm going to do. But you can also purchase that fabric that is used. You can just purchase it and cut it, get big squares of it and cut it. So I didn't know that at the time, but that is available as well.
You can buy the mask with the filter already included.
Yep, and the ones we have that we bought had filters with them, but then you got to buy more filters. So I didn't want to have to buy more filters, and if I could do something better, and I feel pretty confident about our masks. But it's, there was a little girl who came home from school here in the town where I live. And her grandmother was appalled because she had put on a second mask and talked about it was a letter to the editor in the paper, and she talked about her granddaughter's immune system being held back because she wasn't wearing this mask and it was going to mess up her immune system. And I was just like, that's not scientific at all, you know? It's not,
I think so.
you know? And also the whole thing about I can't wear a mask because I have trouble breathing. You see those surgeons, they wear a mask from the time they go in the operating room till the time they leave. And those surgeries can last for hours and hours. And
Yeah, that whole argument, I don't like wearing a mask because I can't breathe. Maybe if you have asthma, like a severe form of asthma, I can understand that, right?
but
if you don't have asthma and you're just, wearing a mask should be fine.
If I, for example, I had pulmonary embolisms and I had to be on oxygen for a year after that. And if you have a really bad breathing problem, you can ask for oxygen from the doctor. They could give you some oxygen to take with you. You wear the cannula and then you put the mask on over the cannula. You know?
Yeah.
It's just it's a moot point to me. It's not even an argument. It's not even valid. So anyway, so remember, you guys, social distance. If you're going to be around people, please protect them and wear a mask.
Yeah.
If you have trouble breathing when you have the mask on, talk to your doctor about the possibility of getting some oxygen to use when you're wearing the mask.
Mm-hmm.
It's we've got to do something. This is not okay. It's not.
Right.
You know, we're going to soon be at 300,000 deaths in the United States. And that's probably, I don't know. I looked this up before when we were at 200,000, and it was like 70 times the number of people who died on September 11th. So it's not okay to not take care of the person across the aisle from you or down the hall, or, just wear a mask. So, all right. So I guess is that it for today? I think that's it for today. Do you have more to say, Jaylee?
No, you took the words right out of my mouth. Break social distance, you guys. Wear your mask while you're out in public.
Yes.
And don't only just think about yourselves, but think about the people around you. Just because you think that you cannot catch COVID, you're healthy, you're in the prime of your life, doesn't mean that your elderly neighbor that's also shopping at the grocery store or who may be immunocompromised may not catch COVID. So don't only think about yourselves, think about the other people around you.
Yeah. So thanks, everyone. Be sure to give us a thumbs up and subscribe. Click the little bell so you get notifications. And we'll see you next time.
All right. Bye.
Bye.